Hi guys, I'm Dr. Wilfred Koon. I'm the principal dentist here at The Point Dental. If you're watching this, chances are you might be worrying about losing all your teeth. Or maybe you're struggling with loose dentures that are just not working for you. And I get asked these questions all the time. Wilfred, I'm about to lose all my teeth, what can I do? Now, if you're living with missing teeth, uncomfortable dentures, or severe dental issues, it might feel like a confident smile is out of reach. The good news is All-On-4 dental implants can completely transform your life, often in just 1 to 3 days. This is something I talk about with my patients almost every day. When someone comes in wondering how to replace all their teeth, or they're feeling frustrated with their loose or uncomfortable dentures, I usually walk them through a few key things. And the truth is, a lot of people don't realize how many options are actually out there. Some are not even sure what they're eligible for. Others have been told they don't have enough bone or they would need bone grafting. And then there's the term 3-day teeth, which can sound too good to be true if you've never heard of it before. So in this video, I want to take you through what's the difference between dentures and full-mouth dental implants. And by the end, hopefully, you'll be more informed and a little clearer on what might be the right options for you. So when you're about to lose all your teeth, or you already have, you generally have 3 choices. The first one is dentures, and then you have overdentures and full-mouth All-On-4 implants. So in this video, I'm going to take you through everything. We're going to talk about what dentures are and how they work, and then we'll look at full-mouth dental implants, especially the All-On-4 technique, and how they compare to dentures in terms of comfort, fit, and long-term results. And you have heard about step-on or removable implant options, often called overdentures. I will be covering those in a separate videos in more detail. So what is a denture? Denture is what people often call false teeth. It's a removable plate that sits on your gum that you can put it in and take it out, and it's usually made from acrylic or plastic teeth. Now, what's good about dentures? So denture is the most affordable way to replace all your missing teeth. They look quite decent, they'll give you your smile back, and they're quite easy to make. And there's no big surgery involved apart from removing any of the remaining teeth. However, many people do struggle with dentures as well. The biggest downside of denture is that it is a removable prosthesis, which means you need to take the denture out to clean after every meal. And at night, before you go to bed, you need to take them out and soak them in a cleaning solution. What I often hear from patients is this: I used to be okay with them, but now I avoid going out to socialize and I start smiling in photos just in case they slip. I even had a patient telling me once she stopped going to social events because she was scared her dentures would fall out when she laughed. That kind of thing really chips away at your confidence over time. The second downside is that it relies on suction on the gum to stay in place. However, not many people will get good suction. So if you wear dentures, and you just need to be a bit more mindful with your daily activities. So anything that can affect the suction will affect the retention of the denture. For example, laughing, yelling, yawning, make sure you always cover your mouth. Otherwise, it is possible for the denture to actually come off from your mouth. I'm sure we have all seen these kind of videos on the internet before. Eating anything that's sticky, such as gummy bears, toffees, cheese, will stick to the denture and will loosen up your denture as well. Even going swimming, when the water gets into your mouth, you will lose the suction. In fact, we actually have seen quite a few of our patients losing their dentures swimming in the beach, and they said it's the most embarrassing moment in their life. Having said that, you can definitely buy denture glue from the supermarket to keep the denture firm in the mouth. However, many people don't actually like using denture glue because it makes the whole mouth really gluey, and every time they try to eat or drink something, they'll be constantly swallowing glue, and the glue doesn't last a long time. They usually last about 2-3 hours, and you need to keep topping them up. Now, the third downside is the decrease in chewing efficiency. So if you look at studies comparing having a full set of natural teeth, the chewing efficiency of dentures drop about 50 to 70%. And the reason is because denture sits on the gum. So when you chew your food, it feels like you're using your gum to chew your food. And they feel very different to your natural teeth or dental implants where the teeth are actually anchored to your jawbone. So when you chew your food with natural teeth or dental implants, you're actually using your jawbone to actually crush on your food. But with dentures, it's very different. And the fourth is comfort. So dentures can feel big and bulky, and they cover the roof of your mouth and they dig into your gums as well. So they can rub against your gum and cause ulcers, and they don't suit people who gag easily. Now, despite all the downsides, dentures still definitely have its place. They are the cheapest and the most affordable options for you to replace the missing teeth. They will give you your smile back, and it's better than not having any teeth in your mouth. So as long as you understand the limitations, it is definitely an option for you to consider. So let's talk about implants, and especially All-On-4 implants. Dental implants are completely different. Instead of sitting on top of the gum, they go into the bone, just like the roots of natural teeth. And That changes everything from how you feel and how you actually function with them. There are different ways to do full mouth dental implants. Some traditional methods involve 6 to 10 implants per arch, often done in stages, sometimes with bone grafting and a fairly long healing process, usually about 6 to 12 months. But what we mostly do here, and what most people find works the best, is what we call All-On-4 dental implants. Now, you may or may not heard of it before, but what makes All-On-4 different is that we only need 4 implants per arch, placed in a very specific positions and angles. And this gives us enough support to fix a full set of teeth without needing any bone grafting. And what surprises people most is this. We can usually remove any of the remaining teeth and infections, place the implants, and give you a new set of fixed teeth all within 1 to 3 days. Yes, teeth that actually stays in your mouth. You don't have to take them out at night. You can speak, you can smile, you can eat with confidence. And that's what people really notice. Not just the way they look, but also the relief of not having to worry about their teeth anymore. Now, some patients will ask me, I've already been told I'm not suitable for implants because I don't have enough bone. Now, and that's something that I hear quite often. But what I usually say is this. Don't count yourself out too soon. Because with techniques like All-On-4 and even zygomatic implants in the more advanced cases, we're often able to help patients who thought they had no other options left. It's just that not every clinic offers a solution like this. With All-On-4, there are a couple of downsides. Firstly is that it's quite a big surgery and we usually put patients to sleep. However, it's actually designed to be very simple for patients. It's not just during the surgery, but also the recovery and the ongoing maintenance as well. For example, like during the surgery, we put you to sleep. So you go to sleep and it makes it easy because all you remember is closing your eyes. When you open your eyes, it's all done. And everything's all done in one surgery. So there's no multiple surgeries. Everything's all done in one go. And the subsequent appointments as well, they're actually quite straightforward. There's no pain involved. You might feel a bit of discomfort here and there, but nothing major. Now, apart from the surgery, the second downside is obviously the cost. It's quite an expensive procedure, to be honest. The range, it can range anything from $20,000 to $25,000 all the way to $35,000. So it all depends on the type of materials that you choose, okay? And this is something that we'll go through with you during a consultation so that you can choose the teeth that is most suitable for you, suitable for your bite and suitable for your lifestyle. So just to summarize the differences between dentures and All-On-4 implants. Firstly, dentures is removable, whereas All-On-4 is a fixed prosthesis, okay? So you don't actually have to take them out. Secondly, cost-wise, denture is more an affordable option, whereas All-On-4 implants can be a little bit more costly for some people. The third difference is comfort. Dentures, obviously, they'll get loose and they do rub on your gums and they do take a bit of time to get used to. And there's a lot of things that you have to consider in terms of your daily activities and how you move your mouth, how wide you're opening your mouth, or what sort of food that you're eating. Whereas with All-On-4, then you just treat them like your own teeth. Like they don't have to come out. You can eat normally, you can have apples, you can have nuts, and they just feel like your natural teeth. So there's really no right or wrong answer which way you want to go. It really depends on what you want, what you need. Everyone has different budget they want as well, how much they can afford. So I think it's best to have a chat with your dentist to find out more information so that you can make a more informed decision what's best for yourself. Lastly, if you want to find out more about what we do or how we can help you or see some of our amazing patient transformation, feel free to follow our social media or subscribe to our YouTube channel.